I rise to talk about the health care reform bill and a most urgent need to make sure that we have provider reform as part of the insurance reform package. And I want to thank the senator from Minnesota for her leadership on this issue. She has hit the ground running when it comes to the issue of health care reform, advocating for changes in policy and introducing legislation at the beginning of this year called the Value Index legislation. But clearly, Minnesota has had good results and is leading the country in the kinds of healthcare practices that we need to adopt. The Medicare system is basically, if we do nothing, is going to go broke. That is, that it is doubling as the cost to the federal government. And we're talking about reform, and we're talking about adding more people in. And so if you look at Medicare spending of where we are today and the amount that we are going to see in the future, we know that we are quickly growing that number from 2009 to 2015 to be over $1.2 trillion. Without health care reform, without even the discussion of adding the uninsured, we know we can't sustain the doubling of Medicare in the next 10 years. So we need to change the system. And we know what the cause of this crisis is too. There are many elements to healthcare and healthcare cost, but we know from the many hearings and testimony that we had from experts that the fee-for-service system is driving up the cost of healthcare. That fee-for-service rewards providers for the quantity of services they provide without regard to whether those services really benefit the patient. Have you ever asked yourself why your physician, while you're in the middle of a healthcare appointment, seems so hurried? Have you ever asked yourself why the doctor seems so hurried to go to the next appointment? Well, the reason is because that is the way we pay doctors. We pay doctors by the number of patients they see and the number of procedures that they order. So the system that we have today actually creates an incentive for doctors to spend as little time with each patient as possible. Now, if you think about that and you think about where our healthcare system is today, how is that good for delivering outcomes? How is that good for making sure that the patient gets the best care? Now, I want to make sure I'm clear. This is not the fault of the doctors. They are just following the rules of the game as it is being played today. And indeed, many physician organizations are advocating the changes of organizational structure that the senator from Minnesota and I are advocating. They understand that healthcare is a daunting task to reform it, but in this case, they know that the problem is simple enough to grasp. All you have to do is follow the money. And what you see in both private insurance and what you see in Medicare is that you are routinely paying for duplicative or inefficient care, and then the cost of Medicare and the cost eventually to taxpayers are skyrocketing. So if you look at the fee-for-service model, it's pretty clear. It's a feedback loop. In business and technology, we call this a positive feedback loop because it just feeds each other. Because you have more use, you order more tests, you have more duplication of services, you have more spending, and the cycle just keeps going. And it keeps perpetuating itself. And the end result is that you just keep adding cost to our system. Nowhere is there an outcome that's judged here. Nowhere is there a value to the patient. And as one national study shows, that there is an estimated $700 billion a year in wasted healthcare dollars. That is, that healthcare spending that may not even be, certainly it's wasted dollars, and some people have said can even do harm in the way that the money is spent. And so, Mr. President, we're out here today advocating for a different model. We're out here saying it's good to talk about insurance reform, but if Medicare is one in every 5 healthcare dollars, and Medicare is driving healthcare spending, it is also driving expensive health insurance. So if we have expensive fee-for-service Medicare that is helping to waste precious Medicare dollars, you bet that it is also driving expensive health insurance. Now, the good news is that we already know that there is a viable alternative. And the reason we know that is because we know that there are states like Washington and Minnesota and many others across the country that have put some of these new practices into place, and we know that they are working in the real world. In some parts of the country, we have reforms that really have reversed these trends, and they cut cost, and they put the emphasis where it belongs. And the bottom line is that they put the patient first. Imagine that, putting the patient first. Not the number of procedures you order, not the number of people you see, but putting the patient first by making sure that we are focusing on their outcomes. That the doctors can take the time with their patients and they can take the lead in coordinating their care. Patients in these delivery systems get better access to their physicians. They experience shorter waiting times. They benefit from coordinated care that's provided by their primary care physician and other healthcare individuals. And the healthcare outcomes are better. Who in America wouldn't like shorter waiting times to get to see the healthcare provider they need to see, or better access to doctors, or to have one doctor coordinate with your other healthcare providers your specific needs and treatments, and to guarantee the outcomes? This kind of delivery system is good for individuals, but it's also good for the taxpayer, because not only does the patient benefit, we cut down on the bureaucracy and that $700 billion in wasteful spending. So I believe that every part of the country ought to take heed of this phenomenal results, and the fact that, as my colleague from Minnesota said, you could save the taxpayer over $100 billion a year if we made this change to coordinated care across the country. And when Medicare is structured in a way that it encourages better quality and a more efficient care, we will also see the price in private insurance go down as well, because the cost and correlation of Medicare driving private insurance is there. So what we want to do, Madam President, is we know that the healthcare debate puts us at a crossroads. It puts us at a crossroads about what we're going to do about our current healthcare system. We can either fix these problems, or we can exacerbate it and make it worse. And we all want to help the uninsured in America, but to add more people to this healthcare system, to cover more people under healthcare without changing the way that we pay for Medicare, is going to explode the federal deficit. And so we want to make sure that we don't exacerbate this problem. That's why fixing the healthcare system but not addressing this issue is not a real solution for us. Because we cannot continue to see people from Washington and Minnesota and other places migrate to high-cost, high doctor pay states with no guarantee of better outcomes, but certainly more pay for physicians. We know the fee-for-service model is bleeding our country, and we know that we need to make changes to that. We need to have a quality care system. So that's why I joined Senator Klobuchar at the beginning of the year in introducing legislation for a value index, and that's why we've been fighting in the Finance Committee to add these kinds of reforms to the system. I'm very proud that the Finance Committee is looking at insurance reform to ban practice such as excluding individuals and making sure just because they had pre-existing conditions, but provider reform in how Medicare is delivered is just as crucial to delivering a good healthcare system in America. And we are advocating that we have a healthcare system that puts the patient first. that puts them in the focus of how physicians get paid. Now, we do this specifically by striking a blow against the fee-for-service and replacing it with a model that allows physicians to spend more time with their patients, to better coordinate their care, to provide them with preventive care for the future, and to make sure that they are getting the quality of care that they deserve. As one of my constituents came in, Madam President, to my office to talk about this, she said, "I don't want to be medicated, I want to be cured." What she meant is, don't write me just a prescription and tell me to go away. I want you to focus on my specific healthcare needs. And that is what so many people think about our healthcare system. At a time when we do have advances in new technologies in preventive care and wellness that can get our consumers focusing on their own healthcare needs. So our proposal changes the current payment incentive structure by using a new value index to measure the quality and efficiency of service. And only by replacing the fee-for-service system with this new value index will we start to really control healthcare costs. According to testimony before the Senate Finance Committee, this is where we are going to get our biggest savings in healthcare cost reduction. The fee-for-service system, as one of the witnesses said, is the most broken part of Medicare. And under the value index system that we're proposing, the federal government would do much better and taxpayers would do much better in making sure that we do not see that doubling of Medicare rates. Those of us who are from these regions are tired of providing efficient, coordinated care. I think the presiding officer is also from one of those states. And you can't believe the frustration that we have of going to community after community, knowing that we provide better outcomes, knowing that we provide better care, knowing that people have made it work on the lowest margins possible, and yet people are leaving our states because they can go make a better buck somewhere else off of the inefficient healthcare system that we're delivering. Now, it would be one thing if they could make that quicker buck by going to some state and they were saying, you know what, we are more expensive, but we deliver better care. I would say to my colleagues that we cannot just have tweaks to this system. We can't just have pilot programs. We can't just gently turn the wheel of the Titanic and think that that is going to avoid the catastrophe we are going to see if we don't reform Medicare. So we will be working hard in the next couple of weeks, as I said, sending a letter to the president and to the leadership here that it's time to fix this system, that we have the opportunity to have a 21st century healthcare delivery system with all the great information and all the great technology that is out there. But this system can't keep rewarding insurance companies by 435% annual profits just because our whole system is set up to order more. Because this really isn't about paying for volume. The point is not to pay for volume. It is to pay for value. And we want to make sure that we are paying for that value and not just the fee-for-service volume system that currently doesn't put patients first in America. So we will be working hard to get these implemented so that we can support this healthcare legislation.